I'm Dorothea, and I'm so excited. I know most of you know me from Let's Talk Sarcoidosis. Well, guess what? We wanted to bring the people to you. We are doing Let's Talk Sarcoidosis on the road. So I want you to come in and join me and see what we have for you today.
And what the Dexa scan will do is it will actually identify exactly where the muscle, bone, and fat is.
Oh my
and for example, on this patient here, and of course she's overweight, you can tell, but the green on here is actually the fat that she has. You can tell there's a lot around the hip, and then the red is the muscle. And you can actually tell that she has a lot more fat than she has muscle, but it can measure it enough so that she can design an exercise and diet program, and then she can do the body composition every several months and then see how she's doing with her regimen. So this is our DEXA scan room, our bone density x-ray room, but also we perform body composition analysis, which is the most accurate way to measure body fat percentage and muscle percentage. It's the most accurate way to do it, and a lot of athletes prefer to get their body composition done this way, but also people trying to lose weight as well, because it's the most accurate way to figure out how your diet and exercise regimen are doing. And are you interested in us doing a body composition on you?
This right here is just the different measurements of, or the locations of measurements that, if we wanted to do a DEXA, we'll measure the lumbar spine, the femur necks, and then whether it's the left or right hand of the patient, that's their non-dominant hand. So these are just other measurements that the software in the DEXA machine provides. But for this one, since we're just doing the total body composition, we're going to be doing a scan of the whole body. So you can go ahead and lay down. Your head's going to go right there on the
paper.
Mm-hmm. And we want your body to be centered up with the center line right here.
I can't, am I centered? Because I don't know.
That should be okay. And we really want when you put your hands down at your side, if you could put them in. So if you could,
right, my hands in right
just
here.
like that. So if you could scoot over just a little bit over towards the wall, and that should, actually you can come back a little bit more. There we go, that right there.
Okay.
And put your hands in as tight as you can to your, there we go, that should be good.
Okay.
And now we're going to strap your feet up.
Okay.
And by the way, Dorothea, this is also how we do bone density x-ray measurements, just so your audience members know.
Only thing is I don't like laying flat down. That's just like, so I hope this is fast.
Yep. So we're going to go ahead and get started.
Okay.
So we just need you to lay still, and about 3 to 5 minutes it should take, and then we'll be all set to go.
Okay.
Weight is very inaccurate as far as telling us how our health is.
Okay.
And when you go to the doctor, we usually do calculate something called the BMI, the body mass index.
I've heard of that. Mm-hmm.
And that's very inaccurate. For example, someone who's morbidly obese could have the same exact BMI as a bodybuilder who's very, very healthy. However, if you put both of those people down and measure their body composition analysis, we'll be able to tell the bodybuilder that he has a lot more muscle and very little fat, and he's very healthy, while the opposite with the person who's overweight. So this, by doing a body composition analysis, someone can find out what their fat percentage is and what's a healthy amount, and it's a much better way to actually measure their health. And then if they go on a diet and exercise regimen, their goal is to decrease the amount of fat and increase the amount of muscle with each scan that they take. And instead of just going by your weight, which is
this is really awesome, because if more people would get this, they would be a lot healthier.
Yes.
Because they would know specifics.
And you remember, and I'm sure you've run into the person who's been on an exercise regimen and they didn't lose any weight.
Yes.
And then they'll say, well, it's because I gained muscle and I lost fat.
Right.
They really have no idea unless they do something like this.
Okay.
They're just kind of guessing at it.
Wow. So this opens up a whole new door of education, because how would we know how to, be healthy if we don't take these,
You're not allowed to move your hands.
Oh, I'm sorry. I talk with my hands. I forgot. Hopefully that doesn't mess it up, but
You'll be fine.
okay. Now, how often should this be done? Just once a year, or?
It depends upon the person themselves. If someone's really motivated and really wants to be meticulous about it, you could do it every 3 months. If someone wants to kind of follow it more slowly, once every 6 to 12 months is fine. But I wouldn't do it any more often than every 3 months.
And does insurance take care of something like this?
No, body composition analysis it doesn't.
Okay.
But we have very affordable prices, and we give out specials all the time for it.
Okay.
It would be nice if insurance did cover it, because it's certainly a lot more accurate than BMIs.
Right. Yeah, the BMIs, I've had that done, and I've had nothing like this at all. I didn't even know this existed. And I'm sure a lot of viewers may not know this exists as well.
Now, insurance does cover bone density x-rays, though. And in fact, all women who are 65 years of age and older, Medicare does take care of bone density x-rays. And every woman who's 65 years old and older should get a bone density x-ray. Very important.
I've had it done because, like I was saying in the interview, that I'm still on prednisone. And I had to get the bone density test. Now, is this something we can get results and we can let people know right now?
Yep, absolutely.
Okay, I'm going to expose myself.
I'm looking at your insides right now on the screen.
The scan that you just saw actually is visible on the results, and you're able to compare it back and forth.
Okay.
If you were to come back in 3 months to get another scan, you can you can physically see the difference of where you were.
And that's very motivating to people. They'll go on an exercise and diet regimen, and to see the amount of green fat decrease and the amount of red muscle increase from one time to the other, visually, that's very motivating to someone when they're doing it right.
Now, I don't know what I'm looking at, but I'm looking at that poster and I'm looking at mine, and I'm seeing a little bit of similarities.
Well, women actually have more fat on the hips.
Yes.
And compared to men, so that's actually a normal.
Okay.
All
right, so give me the scoop.
That's the classic pear shape. What we call the pear shape.
Okay, I want to know the real scoop. So, how many of these do you do per day?
Not very many. It's not that well known yet as far as a modality. Like, you've probably never heard of it.
I've never heard of it.
I've
never heard of it.
It's a fairly new type of way of measuring body composition. People hear about bodybuilders taking anabolic steroids to build up their muscle, and it decreases fat. Unfortunately, prednisone, a catabolic steroid, does just the opposite. It's actually eating up your muscles and making fat.
Oh my goodness.
And so this isn't totally your fault. This is a big part to do with the prednisone, and it takes a lot of work through diet and exercise to try to reverse that. But as you can see, this is unfortunately the ravages of what prednisone does.
And that's why I'm saying it's very important for this episode, because people need to know exactly what these medications can do, the side effects.
Absolutely.
And, the only way they will know, Dr. Thomas, is if we continue to have shows and let people see, and use myself as an example so people can see what we're dealing with, or any other person out there who's on medication and in the same situation that I'm in.
Well, before ultrasound, we had to rely completely on the physical exam by putting joints through range of motion.
Okay.